is a healthcare advocate, and do I need one? In general, a healthcare advocate is someone who helps you navigate through the healthcare system. Now, that could be a family member, could be a friend, or it could be a professional. I began my private practice in 2020. I'm a nurse, care manager, and board certified patient advocate, but health advocates can come in all shapes and sizes. Some have a specialized skill in, say, medical billing or insurance, while others may have a specialized clinical skill, such as in breast cancer or rare diseases. My path to advocacy began with an incident with my own dad. And maybe you can relate. I live here in Florida, in the Tampa area, as you know. My dad at the time was still living back up in the St. Louis area, which is where I'm from originally. He was in the hospital. He was having some toes removed as a direct result of his diabetes. I was able to go up and be at the hospital with him. Not all families have that ability to have a nurse and a family member at your bedside. I was amazed as I was up there that, first of all, he was in the hospital as a direct result of his diabetes, yet his endocrinologist, which is his diabetes doctor, did not know he was there. I was also amazed as I was sitting bedside that it seemed like every time someone came in the room, they had something wrong, whether it was his health history, his medications, the follow-up, and it really got me to thinking there's a lot of families out there that don't have the ability to have an advocate at the bedside or following a case. So that's where my advocacy journey began. As a healthcare advocate, my goal is to make sure that you have and understand all of your healthcare information so that you can make the most informed decisions. And then I work to make sure nothing falls between the cracks. Now, that can manifest itself in many ways. I have some clients that I manage all of their healthcare. I make appointments, I attend appointments, I follow hospitalizations, I follow discharges, I keep the families up to date. I do everything from scoop to nuts in their healthcare. Other clients, it's more of a periodic advocacy. Let's say you've got a loved one in the hospital and you're not quite sure what the plan is. You aren't understanding things. You don't know what the follow-up is. You need help navigating from hospital to rehab to home. You need help sourcing resources, home health, private duty care, other services that might be helpful for home. I have some clients that are what we consider solo agers. So they don't have family or a close friend that can kind of help them as they go through the healthcare system. So I become their advocate. And of course, there are also medical billing issues, insurance appeals, a medication gets denied, a discharge is happening, but you think that you're being discharged too soon. Any one of those are things that I can work with as an advocate. It's important to note also that as healthcare advocates, we work with clients of all ages. Some of my younger clients are clients who had maybe a difficult diagnosis, a new diagnosis, a complex diagnosis, and they need help kind of navigating through the system, understanding what their benefits are and what resources are available. Also important to note that as an advocate, a lot of my clients don't live near me. I can do a lot remotely if needed. Now, sometimes if I need to attend appointments in person or go to a hospital in person, I need to be right there, but I have clients all over the country. When I tell people what I do, the most common response I get is, "Wow, that's really needed," followed quickly by, "I didn't know those services existed." So if you know someone who might benefit from having a healthcare advocate, I want to encourage you, please forward this video or reach out. And if you want to learn more about our healthcare system and how to navigate, I want to encourage you to follow. And if you've got questions or concerns about healthcare, drop us a comment.